Fibers from living skin. Patients with Morgellons disease report colorful fibers, threads, and black specks emerging directly from their skin, often accompanied by intense itching and crawling sensations. The condition first gained attention in 2002 when biologist Mary Leitao coined the term after her young son developed mysterious skin lesions with fiber-like materials. Medical professionals remain sharply divided on Morgellons' legitimacy. The CDC conducted a comprehensive study from 2006 to 2012, examining 115 patients and finding that most fibers were common materials like cotton or nylon, likely picked up from clothing or environment. However, some patients showed unexplained skin lesions and reported debilitating symptoms including fatigue, joint pain, and cognitive difficulties. The controversy persists because while many cases appear linked to delusional parasitosis, a psychiatric condition where patients falsely believe they're infested with parasites, some patients display physical abnormalities that don't fit this diagnosis. Recent research has identified unusual keratin and collagen formations in some patients' skin samples, suggesting a possible biological component that mainstream medicine hasn't fully explained. Muscles become living stone. Fibrodysplasia ossificans progressiva transforms the body's repair system into a devastating enemy, causing muscles, tendons, and ligaments to gradually ossify into bone whenever damaged. This ultra-rare genetic disorder affects roughly 1 in 2 million people worldwide, creating a progressive prison of bone that eventually locks the body into a single position. The condition results from a mutation in the ACVR1 gene, which normally regulates bone and cartilage development. When tissues are injured, even by something as minor as a biopsy or fall, the mutated gene triggers runaway bone formation instead of normal healing. Patients typically develop their first symptoms in childhood, with characteristic malformed thumbs serving as an early warning sign. Harry Eastlack, perhaps the most famous FOP patient, donated his skeleton to medical research after his death in 1973. His remains, displayed at the Mutter Museum in Philadelphia, show how his entire spine, ribs, and limbs fused into a solid mass of bone. Most patients become completely immobilized by age 30, with death usually occurring from respiratory complications when chest muscles ossify and prevent normal breathing. Explosions that aren't there. Exploding head syndrome causes patients to hear deafeningly loud crashes, gunshots, or explosions inside their heads just as they're falling asleep, despite complete silence in their surroundings. The phantom sounds are so realistic and startling that many people bolt upright in terror, convinced something catastrophic has occurred nearby. First documented by physician Silas Weir Mitchell in 1876, the condition typically strikes during the transition between wakefulness and sleep, when the brain's normal shutdown process malfunctions. Instead of gradually reducing neural activity, certain brain regions fire simultaneously, creating the auditory hallucination of explosive noise. Episodes can occur nightly for weeks or remain dormant for years. Despite its alarming name, exploding head syndrome causes no physical pain or lasting damage. The condition affects roughly 10% of the population at least once, with higher rates among women and people over 50. Recent sleep studies using EEG monitoring have confirmed abnormal electrical activity in the temporal lobe during episodes, but researchers still can't predict when attacks will occur or fully explain why the brain creates these phantom explosions. Waking up with new accents. Foreign accent syndrome transforms a person's native speech patterns overnight, making them sound as if they've acquired a completely different nationality's accent without any exposure to that culture. This neurological condition typically follows strokes, traumatic brain injuries, or in rare cases appears spontaneously with no identifiable cause. The most famous case involved Norwegian woman Astrid L., who developed a German-sounding accent after being struck by shrapnel during a 1941 air raid. Her altered speech patterns persisted for life, causing social isolation as fellow Norwegians mistook her for an enemy collaborator. Similarly, American Lisa Alamia woke up in 2008 speaking with what sounded like a British accent following dental surgery complications. The syndrome results from damage to specific brain regions controlling speech coordination, particularly areas that regulate tongue placement, rhythm, and intonation. While patients don't actually acquire foreign languages, their altered pronunciation patterns coincidentally resemble other accents. Only about 150 documented cases exist worldwide, with most patients retaining their new speech patterns permanently, fundamentally changing how others perceive and interact with them. Everything looks wrong size. Alice in Wonderland syndrome distorts visual perception so drastically that familiar objects appear gigantic or microscopic, while patients' own body parts seem to shrink or swell beyond recognition. Named after Lewis Carroll's famous story, this neurological condition transforms the visual world into a disorienting funhouse, where size relationships become completely unreliable. British neurologist John Todd first described the syndrome in 1955, though Carroll himself likely experienced these symptoms, as evidenced by his detailed descriptions in Alice's Adventures in Wonderland. The condition commonly affects children between ages 5–10, often triggered by migraines, Epstein-Barr virus infections, or epilepsy epileptic seizures. Episodes typically last minutes to hours, but can persist for weeks. The visual distortions occur when the brain's parietal cortex, responsible for processing spatial relationships and body awareness, malfunctions during neurological events. Patients might perceive their hands as enormous, while doorways appear impossibly tiny, or see people as miniature figures in a vast landscape. While frightening during episodes, the syndrome rarely causes permanent damage, with most children outgrowing symptoms by adolescence as their nervous systems mature and stabilize.
Believing you're already dead.
Walking corpse syndrome convinces patients they have died, are rotting away, or have lost essential organs, despite overwhelming evidence of their continued existence. This rare delusion, formerly known as Cotard syndrome, represents one of medicine's most bizarre psychiatric conditions, where people become absolutely certain they no longer belong to the living world. French neurologist Jules Cotard first documented the condition in 1880 when treating Mademoiselle X, a 43-year-old woman who insisted she had no brain, stomach, or intestines and was condemned to eternal suffering. Modern cases include patients who stop eating because they believe they don't need food as corpses, or who request to be taken to morgues where they feel they belong. The syndrome typically emerges during severe depression, schizophrenia, or following brain injuries affecting the parietal cortex and fusiform face area. These brain regions normally help maintain our sense of self and bodily awareness, but when damaged, they can create the terrifying conviction of non-existence. Treatment with antipsychotic medications and electroconvulsive therapy can restore patients' connection to reality. The recovery often requires months of intensive psychiatric care.
Muscles that lock on command. Stiff person syndrome transforms everyday sounds and emotions into triggers that instantly freeze muscles into painful, board-like rigidity, effectively turning the body into a living statue. Patients experience sudden muscle spasms so severe they can break bones, while loud noises, stress, or even gentle touches can lock their entire torso into concrete hard contractions lasting hours. Canadian singer Celine Dion revealed her diagnosis in 2022, explaining how the condition forced her to cancel world tours when muscle spasms made walking and singing impossible. The syndrome affects roughly 1 in a million people, with women developing it twice as often as men. Patients often describe feeling like human boards during episodes, unable to bend or move while remaining fully conscious and aware. The condition occurs when the immune system mistakenly attacks neurons that produce GABA, the brain's primary inhibitory neurotransmitter responsible for muscle relaxation. Without adequate GABA signaling, muscles remain in constant contraction, creating the characteristic stiffness. High-dose benzodiazepines and immunosuppressive drugs can provide relief, but many patients become wheelchair-bound as the disease progresses, with severe cases proving fatal when respiratory muscles become affected.
Diplomats' mysterious brain injuries. Havana Syndrome strikes government officials and intelligence operatives worldwide, with sudden onset of severe dizziness, memory loss, and debilitating headaches, often accompanied by strange sounds described as grinding metal or piercing beams. The condition first emerged in 2016 when CIA officers stationed at the U.S. Embassy in Havana, Cuba, began reporting identical neurological symptoms that defied medical explanation. Over 1,000 American personnel across 6 continents have since reported similar incidents, including diplomats in China, Russia, and Austria, who experienced sudden cognitive impairment and balance problems. Brain imaging reveals actual structural changes in affected individuals, with some showing signs consistent with traumatic brain injury, despite no physical trauma. The CIA's top Moscow station chief was evacuated in 2017 after developing severe symptoms that ended his career. Intelligence agencies remain divided on whether the syndrome results from directed energy attacks using microwave weapons, mass psychogenic illness, or unknown environmental factors. A 2023 intelligence assessment concluded that foreign adversaries likely caused some cases, while others might represent coincidental medical conditions. The National Institutes of Health continues studying affected personnel, but the syndrome's true cause remains one of modern medicine's most politically sensitive mysteries.
The girl who never grew. Syndrome X creates the medical impossibility of children who remain frozen in infancy while their chronological age advances normally, baffling researchers who cannot explain how aging simply stops in otherwise healthy individuals. Brooke Greenberg became the most studied case, remaining physically and mentally equivalent to a toddler despite living to age 20, weighing only 16 pounds at her death in 2013. Baltimore geneticist Richard Walker extensively studied Brooke and similar patients, discovering that different body systems aged at completely different rates or stopped aging altogether. Her baby teeth never fell out, her bone structure remained infantile, and her brain showed no development beyond that of a young child. Yet she experienced normal childhood illnesses and could survive standard medical procedures, indicating her basic biological functions remained intact. Scientists believe Syndrome X results from mutations mutations affecting the genetic programs that coordinate development and aging across different organs and tissues. Only a handful of confirmed cases exist worldwide, with most patients dying in childhood from complications related to their developmental arrest. The condition offers unique insights into aging mechanisms, but researchers have yet to identify the specific genes responsible for keeping these individuals perpetually trapped in early childhood.
When faces become strangers. Prosopagnosia erases the brain's ability to recognize familiar faces, forcing patients to rely on voices, clothing, or distinctive features to identify even their closest family members and friends. This neurological condition affects roughly 2% of the population, ranging from mild difficulty distinguishing between similar-looking people to complete inability to recognize their own reflection in mirrors. British researcher Jane Goodall first brought attention to the condition in scientific literature, though many famous individuals, including artist Chuck Close and primatologist Oliver Sacks, have publicly described living with face blindness. Patients often develop elaborate coping strategies, memorizing specific details like hairstyles, walking patterns, or unique jewelry to identify people in their daily lives. Social situations become exhausting exercises in detective work. The condition results from dysfunction in the fusiform face area, a specialized brain region dedicated exclusively to facial recognition that develops separately from other visual processing systems. Congenital prosopagnosia appears to run in families, suggesting genetic origins, while acquired cases typically follow strokes or traumatic brain injuries. Despite decades of research, scientists still cannot fully explain why the brain evolved such specialized face processing machinery, or why it fails so selectively in affected individuals.
The hand with its own mind. Alien hand syndrome creates the terrifying experience of losing control over one hand, which begins performing complex, purposeful actions that directly contradict the patient's conscious intentions. The affected limb might unbutton clothes while the person tries to dress, throw away items they want to keep, or even attempt to harm the patient's own body, all while feeling completely foreign and uncontrollable. The condition typically emerges after strokes, brain tumors, or surgical procedures affecting the corpus callosum, the bridge connecting the brain's left and right hemispheres. American patient Karen Burns became famous for her left hand's aggressive behavior following brain surgery, describing how it would grab objects, tear up papers, and once attempted to strangle her while she slept. Patients remain fully aware and horrified by their hand's actions, but cannot consciously stop the movements. Neurologists believe the syndrome occurs when communication breaks down between brain regions responsible for planning movements and those controlling execution. The disconnected hand continues receiving motor commands from parts of the brain, but loses integration with the patient's conscious decision-making processes. While some patients learn to restrain their alien hand or keep it occupied with simple tasks, others require constant vigilance to prevent their own limb from acting against their will.
Born without pain's protection. Congenital insensitivity to pain creates the dangerous paradox of children who can break bones, suffer severe burns, or bite through their own tongues without experiencing any discomfort whatsoever. This ultra-rare genetic condition affects fewer than 100 documented cases worldwide, leaving patients vulnerable to life-threatening injuries they cannot detect through normal pain signals. Pakistani girl Ashlyn Blocker became internationally known when she repeatedly injured herself as a toddler, chewing off the tip of her tongue, breaking her ankle while jumping off furniture, and placing her hands on hot stoves without flinching. Most children with the condition die before age 25 from accumulated injuries, infections, or overheating, since they cannot feel when their body temperature becomes dangerously elevated. The condition results from mutations in genes controlling sodium channels that normally transmit pain signals from nerve endings to the spinal cord and brain. While scientists understand the basic mechanism, damaged SCN9A genes prevent pain neurons from firing, they cannot fully explain why evolution preserved such a critical survival system, or why these specific genetic pathways are so essential for normal pain processing. Current research focuses on using these patients' unique genetics to develop better pain medications for the millions who suffer from chronic pain conditions. Remembering every single day. Hyperthymesia grants individuals the extraordinary ability to recall virtually every detail of their personal experiences, allowing them to remember what they wore, ate, and did on any specific date stretching back decades. Only about 80 confirmed cases exist worldwide, with patients able to answer questions like, "What did you have for lunch on March 15th, 2003?" with startling accuracy and vivid detail. American woman Jill Price became the first documented case in 2006 when University of California researchers verified her ability to recall personal events from any any date since age 10. She described her constant stream of memories as overwhelming and exhausting, comparing her mind to a running movie that never stops playing scenes from her past. Similar patients report being unable to forget trivial details, embarrassing moments, or painful experiences that most people naturally let fade. Brain imaging reveals enlarged temporal lobes and enhanced connections between memory processing regions in hyperthymesia patients. But neuroscientists cannot explain why their brains developed such unprecedented recall abilities. The condition appears to involve both superior autobiographical memory encoding and unusually efficient retrieval systems. Yet researchers have found no common genetic markers or environmental factors linking affected individuals. Most patients view their perfect memory as more curse than gift, struggling with an inability to move past negative experiences.
Awake but trapped inside. Sleep paralysis creates the terrifying experience of being fully conscious and aware while remaining completely unable to move or speak, often accompanied by hallucinations of shadowy figures, crushing chest pressure, or demonic presences in the room. Episodes typically occur during the transition between sleep and wakefulness, lasting seconds to minutes that feel like hours of helpless panic. The condition affects roughly 8% of the population worldwide, with higher rates among shift workers, students, and people with irregular sleep schedules. Cultural interpretations vary dramatically. Cambodians call it ghost depression. Mexicans describe "se me subió el muerto," the dead climbed on me, while Newfoundlanders blame attacks by the old hag. Many patients report identical experiences of feeling an evil presence in their room, combined with inability to call for help. Sleep paralysis occurs when the brain's REM sleep mechanisms malfunction, causing the normal muscle atonia, temporary paralysis that prevents people from acting out their dreams, to persist after consciousness returns. The accompanying hallucinations result from dream imagery bleeding into waking awareness, while the visual cortex remains partially in REM state. Despite feeling supernatural, the episodes represent a harmless glitch in sleep cycle regulation, though the psychological terror can create lasting anxiety about going to sleep. Laughing until death. Kuru transforms the brain into a spongy mass riddled with holes, causing victims to develop uncontrollable laughter, tremors, and difficulty swallowing, before inevitably dying within months of symptom onset. This fatal prion disease devastated the 4 people of Papua New Guinea throughout the mid-20th century, killing over 2,700 individuals in a population of only 11,000 people. American researcher Carlton Gajdusek won the Nobel Prize in 1976 for discovering that Kuru spread through the forays mortuary cannibalism practices, where family members consumed deceased relatives' brains as part of funeral rituals. Women and children who traditionally ate the most infectious brain tissue died at much higher rates than men. The disease earned its name from the foray word meaning to shake, reflecting victims' characteristic trembling movements. Kuru belongs to the same family of prion diseases as Creutzfeldt-Jakob disease and mad cow disease, caused by misfolded proteins that force normal brain proteins to adopt the same deadly shape. The infectious prions remain active for decades, with new cases still appearing 50 years after cannibalistic practices ended, demonstrating the extraordinarily long incubation periods possible with prion diseases. Scientists continue studying remaining Kuru patients to understand how prion diseases spread and why some individuals seem genetically resistant to infection.